Yes, we're watching news today on Joy News. Traditional birth attendants in part of the Central Town District of the Volta region are innocently exposing the health of mothers and children to infections due to lack of delivery items and regular professional supervision. In Dover, a village where pregnant women are barred from giving birth, access to transport and a proper health center for these women in labor are big challenges. Their only option under the circumstance for safe delivery is to find a traditional birth attendant in nearby communities to have their babies. In our latest hotline documentary dubbed Land of No Birth, Joy News' MFA Ewena Matiamoeli visited two of these traditional birth attendants and report on how the TBAs are using unhealthy delivery items to save mother and child.
Azato Anyimonu and Mama Anthony are both traditional birth attendants in the Central Town District. The jobs of these two women are very critical because they are the first port of call for Dover women in labor. Azato lives in Dokpo. She had to sacrifice her kinky business for this job even though she rarely gets paid for her services.
Sometimes I charge 50 Ghana cedis, but even that, it is not everybody who is able to pay. Others pay half. There are times when the delivery is complicated, and by God's grace, it is successful. We talk to them, and they later return to pay everything. There are those that you will just have to consider because they will say their husbands are not available, and so they will pay half of the amount, promising to settle the rest later. Some do, but others never return.
This is where she receives her patients. A small room belonging to her brother, who is a staff of a quality grains company. Azato personally buys the items she needs to do the deliveries. In her little wooden box are old and worn out rubber gloves, which are discolored, an indication they have been kept here for too long. She also showed me a dusty dark brown bottle supposed to be containing her antiseptic and another which contains spirits for dressing sore and the umbilical cord. An old roll of cotton is among the items. But this gives me cause to worry. This woman clearly has a good heart in helping to save the lives of mothers and children, but obviously not with these items. Mama Anthony is another TBA at Dokpo. She lays rags on the floor in this room to deliver her patients of their babies. She says she doesn't understand why the nurses who used to come by to give them those items have stopped visiting.
In a related development, Upper West Regional Director of the Ghana Health Service, Dr. Winfred Ofosu, has expressed worry over the number of cases of maternal death in the region. Even though there have been a reduction from the cases from 30 in 2015 to 24 in 2016, he stated that it is still unacceptable for women to lose their lives through childbirth to such a magnitude. Refusal of critical medical staff to accept posting to the region, poor access to communities coupled with dispersed and nomadic population has been penciled as some of the key reasons why the region continues to record high figures on maternal deaths in the region. Dr. Winfred disclosed this at the annual performance review of the Upper West Directorate of the Ghana Health Service in Wa. Rafiq Salam has details.
Annual performance reviews organized by the Ghana Health Service for its stakeholders offered them opportunity to assess their performance based on their annual plans and targets during the period under review. The two-day conference was held on the theme Child Survival in the Upper West Region, Successes, Challenges, and the Way Forward. Upper West Regional Director of the Ghana Health Service, Dr. Winfred Ofosu, noted that the region is still challenged with the issue of attracting critical medical staff to its various health facilities, such as medical doctors, pharmacists, and midwives, as they are not ready to accept postings to the region.
By the close of 2016, the region had a total of 47 permanent medical doctors at post. This is an increase from 38 medical doctors in 2015 and 33 in 2014. The doctor population ratio therefore has improved from 1:22,940 in 2014 through 1 doctor to 20,300 in 2015 to 1 doctor to 16,862 people in 2016. We are moving towards the national target of 1 doctor per 9,000 population gradually.
Maternal mortality under the year under review reduced from 30 to 24 deaths. Despite the reduction in the mortality figures, Dr. Winfred Ofosu was still not happy with it and described it as unacceptable.
Maternal mortality continues to be a major worry to us. Although in 2016 we recorded a reduction from 30 deaths in 2015 to 24 deaths, giving a maternal mortality ratio of 118 per 100,000 live births, it remains unacceptably high. Anemia, infections, inadequate blood availability in our facilities, late reporting at facilities, weak emergency response at the health facilities contribute significantly to maternal mortality in the region.
Another issue of concern for the region is the poor access to many communities and settlement due to poor road networks, floods, dispersed and nomadic nature of the population. Reporting for Joy News, Rafik Salam.
Let's come back here to Accra and precisely to the Flagstaff House, where President Akufo-Addo has sworn in new members of the Council of State, and he charged them to discharge their duties dispassionately.
Our elders say that it is always better to get the benefit of 2 or more opinions than to rely on one viewpoint. I believe the Akan saying is Tikro Nko Ejina. In our custom, therefore, no matter how smart or how well endowed, every chief or leader has a group of elders to advise him or her. You are that body. And luckily for me, you come from different backgrounds and have a wide range of competence and experience, which, if properly harnessed, will enable you to perform effectively this all-important function. To this end, it is my expectation, and I believe the expectation of the entire nation, that you will elect from among you a chairperson who will be equal to this task. In our tradition of praise, singing, and grand titles, it must be very tempting for a president to lapse into thinking that he is all-powerful and able to do whatever he wants. We have had the experience of presidents being accorded long and elaborate titles and being told that they are all-powerful and cannot be contradicted. Members of the Council, it is in the light of such experience that the framers of our Constitution found it necessary to establish a Council of State to give impartial and objective advice to the President. It is important, therefore, that regardless of whatever your background, you would discharge your duties dispassionately. This means that the Council has a great responsibility. It would be easy to fall into the well-known temptation of telling the President what you think he wants to hear. It would be equally tempting to tell the President he's the best thing that ever happened to Ghana. And it would be even more tempting to tell the President to ignore his critics. I expect this Council will not walk this road. After almost 25 years of the Fourth Republic, I think it is fair to say that the most effective Council of State we have had has been the one that worked with President John Agyekum Kufuor. We saw an intellectually vibrant and active council that took its responsibilities seriously. We saw a council that kept its members well informed and kept government officials on their toes. Members of the council, in my view, the council is not an extension of the executive, and you will not thus be representing the president or his ministers of state. I look forward very much to working with the council that will offer me straightforward advice based on unvarnished truth. I look forward to working with a council that will help all of us deepen our democracy. And I look forward to working with the council that will help us deliver a prosperous Ghana. Such a council.
Now, Housing Minister Samuel Atachia says he needs $700 million to permanently fix the flooding menace in Accra. After a tour of some parts of the capital this morning, the minister said temporal solutions will be put in place to avert flooding as the rain set in, with dredging and distilling of the Odo being the foremost. He asked Ghanaians to stop continuous dropping of refuse in the drains.
It's very unfortunate. The dimension which saddens me are all human related. How our sense of hygiene is not too good, how we pile a lot of garbage along the areas where we shouldn't do, and then they are all tipped into the drains and bring about some of the situations we are facing. So let's improve our sense of sanitation as a factor. The second thing which is very important to me is that we saw some areas in which walls that are just being constructed are broken down. Is it a situation in which we don't appreciate value for money? Who are the contractors? We need to find out, and if they have to be surcharged for what has happened, they should be surcharged. Then what is very, very important is what we are seeing is becoming perennial, and we need to find a permanent solution to this. And I think what is on my table now is enough that if we have the money to do it, we won't see what we are seeing, because we can't be coming here every year as if we are condemned to repeat our mistakes. That's not how you run a system. If you have a situation in which it's choked and then there should be desilting, we'll do it as a temporary measure. But there's a permanent solution in which some of the things we will not be seeing again, and it's very, very capital intensive. And we need to find the money to give it a permanent solution. It's one of the priority areas I'm going to look at. It's very, very important. The master plan is there, and I'm going to push that we find the finances to do it.
How can you assure us that after your plans, we're not going to face what you call perennial poverty?
My only approach is finding the money. Because let me tell you, the engineering sense won't change. We are not going to invent the wheel. The engineers have put together the solution, what we should do as a country to solve this perennial problem. All we need to do, which is the solution, is the cash. If you have the money, the engineers will just roll out the plans and they start working, and you won't see this again. So this is what stares at us in the face every year. We'll find the money and do it.
Whilst you wait and look for the money, the rains will not wait for you. So then
Now, Johnny's has uncovered questionable payments at the Public Utilities Regulatory Commission. Among these is the transfer of close to 500,000 cedis into the personal account of the Executive Secretary of PURC, Samuel Sapon. In the first of a series of reports, an audit of financial records at the Commission, Joy News' Kwete Nate reports the expenses included payments described as protocol cash for the Asantehene, Otumfuo Setutu II.
The amount in question, 435,087 cedis, was part of 1,225,000 cedis paid by the 5 major utility companies to the PURC for the 2013 tariff review hearings nationwide. This money was supposed to be lodged in the account of the PURC, but documents cited by Joy News indicate that 271,500 cedis was paid into the personal account of the Executive Secretary of PURC, Samuel Sapon. Details of the deposit voucher reveal the money was paid on the 16th February 2013 at the Gulf House branch of ADB. Former head of finance at PURC, Isaac Hassan, who made the payment into the account, said he did this on the instructions of the Executive Secretary.
I'm only an employee and I take instructions. There was a workshop that money needed to be transferred, and the Chief Executive volunteered that the money should be paid into his account. So he gave us the account number and the branch to pay in. And I did just that as a lawyer worker.
Under what circumstances did the Chief Executive ask you to go and pay the money into his account?
The workshop was taking place on a Saturday, and as at Friday by about 5 p.m. we had not got the money. So we took this money and paid in on a Saturday into that account. The account is not for me. How could I have just walked in and pay money into somebody else's account without instruction? It is not possible. I'm a professional.
A second payment of 163,587 cedis was also made into Mr. Sapon's Gulf House account on the 7th June 2013. Mr. Hassan tells me, though it's not the norm, his boss thought it was convenient.
Yes, it was money that was withdrew from Ghana Commercial Bank.
And I understand that this was part of monies that was allocated for the public hearings.
That is correct.
So such a money, how does a chief executive get someone to pay monies meant for a certain program into his personal account? Is that the norm?
No, it was just, I would say, a convenient way of conveying the money on a weekend.
In